here, I'm still here, breathing. Let me be the dove fly. So why not I in the storm, in the sky?
Hello, everyone. Welcome back to Still Here. I'm your host, Jason Flynn. Today, I have the privilege of speaking with Trudy Campbell, a nurse practitioner, about her experiences in being a caregiver for her mother. Welcome to Still Here, our podcast where we are talking with caregivers, and we have known each other for a long time, and you came to mind when I was thinking of someone I would love to talk to. So welcome.
Thanks, Jason. It's something I've been looking forward to, actually, since you mentioned it to me. Initially, I was a little bit anxious, but yeah, it's good.
I remember the text came back, and I think it said, okay, question mark, or sure, question mark.
Something like that.
In other words, expand on this and tell me a little bit more.
Yeah, it's grown on me since then.
Good.
So,
Good.
Yeah.
Well, I would just love us to be able to talk, get some of your story. What came to mind when I was thinking of you was the idea of there's so many professionals out there in the role of professional caregivers that also have these experiences of also being personal caregivers for their families, for their loved ones. And I was just really curious about that dynamic of those two roles and how did they support each other and how did they maybe possibly or potentially sometimes get in the way of each other.
Yeah.
So maybe I'll start off with the first question. Maybe just tell me a little bit about your profession and what you do, and we'll go from there.
Okay. So I am a nurse practitioner. I've been a nurse practitioner for over 20 years. And along with that, I'm a mother of two, a wife, and an only child. And actually, I don't have many cousins or relatives, so I'm the go-to for some of the extended family as well.
Okay.
Yeah, so I'm, I guess you'd describe me as a sandwiched person.
I would have never done that before, but thank you for letting me know. And when did you experience having a family member become ill, where you started to become a caregiver in a different way?
Yeah. So I guess the most recent or the most prolonged was during my mother's illness. My mother had dementia. It was not of an early onset, so it was kind of around the age one would expect, late 70s. And slowly I could see her abilities, cognitive abilities, physical abilities, starting to slide just a little bit. And so I started to notice these things and started to advocate to have her assessed. Initially by our family physician, and then, from their specialists and other supports in the healthcare system.
Okay. And I've been in a role of advocating when my mother was ill with leukemia and going into those meetings, the first meetings and the assessments and then going into more of in care and unfortunately in and out of emerge at times and trying to be the voice when that person maybe didn't have as much of a voice as they did before. Was that a difficult thing for you, or with that slow transition, were you able to kind of learn it in the moment as you went through it?
Yeah, it was a challenge at different times. I think for me, I struggled with what my expectation of the system would be, what I knew that the system could offer, because I work in the system, and so I see patients of mine who have struggles accessing various either departments or services out in the community. And so there was this tug back and forth of, am I the daughter? Am I the healthcare provider? How do I advocate for something when I know maybe it's not really there in the first place? And how do I adjust my expectations of the ideal to what is reasonable and good care? And I think that probably was the piece that I needed to remind myself most of, is that there may be the ideal that we maybe dream should happen. And holding on to that ideal without making some, I guess, adjustments, even cognitively, sort of understanding that, even though you try everything, it may not just be the perfect image that you want to see happen. And I think kind of looking at that and adjusting regularly if my expectations of others were too high.
Mm-hmm.
I think as well, I'm sort of still going through some of those things. So I'm a power of attorney for my uncle who has dementia as well. He's my mother's youngest brother. My mother passed away 3 years ago. And at that time, he was beginning to start to show signs of dementia as well. And for him, I guess the difference was that he wasn't my parent. And so there's that boundary. A parent, maybe you can be, at least I felt I could be, and my mom always looked to me for advice or help or assistance. She'd be the first person I would call, sometimes multiple times.
Yes.
And that was before the dementia. And that was a good relationship.
Mm-hmm.
But with an uncle, they're more independent. He didn't have children of his own. So it was learning that new step of boundaries with his independence and his right to make decisions for as long as he was able to. Right. And so as his dementia progressed, it was obvious that he needed to move into long-term care to be safe. And we've had some struggles there too. And it's been a challenge because he is in Prince Edward Island and I'm here. So getting the phone call, this has happened, or we need to do, this. He's got a cold or an infection. We're going to treat him with antibiotics. And hearing those, and not being able to see for myself is challenging. And I have to check myself regularly to say, well, maybe when you go in and he's, says he's a little chilly because they have the air conditioning turned up and he's not wearing a sweater, maybe it's not the right thing to just kind of go and chase down the nurse and go, why don't you have him wearing a sweater?
Of course.
It's taking that step, that breath, and saying, that might be the ideal. That might be what I would do if it were me. But I'm also not here. I'm not looking after him 24/7. And it can be very challenging to provide that one-on-one care to a family member or to anyone for 24/7. And so the ideal may not happen even if it's you doing it.
Well, and as you're talking about both your mother and your uncle, looking at it from when I talk to people about the things that they can control in their lives, so the things within their control and the things that are out of their control, which they have to learn how to accept. And so in that realm, what are some of those things? You talked about your knowledge and struggling with having knowledge and your expectations and having to shape those expectations, or to maybe to have some acceptance there, those things you weren't able to control. What are some examples of that you had to navigate, where you had to accept certain things that are out of your control, such as the distance, for instance, from your uncle, where you have to say, okay, there are caregivers there, and I'm going to do what I can from here. But so what are some of those parameters maybe with your mother to start?
Yeah. So my mom's situation was a bit interesting. I had seen her have her first episode where she was completely disoriented. We were in a very familiar mall to her in Halifax one Sunday afternoon and just having a nice afternoon out. And she began asking, what are those cars out there? And she was referring to the mall inside and the people walking back and forth. So it was very clear to me then something was wrong. And trying to have those conversations with her family physician. Not that he wasn't supportive or recognizing, but I wasn't sure that I always felt that he was acting on it as urgently as I felt the need. I remember him saying, oh, it's, don't worry, it's probably nothing. Or, it's a one of, this is not necessarily a progression of dementia. We'll cross the bridge when we get to it. And still, I remember that moment very clearly and go, that was the first clear sign to me, at least, that something was changing, that something was just more than normal aging, normal mild sort of cognitive impairment or easily distracted or whatever. Yeah.
So there was an communicated, maybe we need to be patient as this kind of patience, as this unfolds. But this is your indicator, your personal instincts, your all of that, of your knowledge of your mother is kicking in here as well. And so is there some tension there that you first experienced, where there was, the doctor was saying, okay, well, let's just count on you saying, well, we need to move on, this may be faster than you're suggesting?
Yeah, I think so. I think there was the tension of my concern about her well-being, her safety, my concern about how this would impact our entire family, and how best to support her at this point in time, realizing that at that point, my kids were young. They needed a lot of help day to day, just their normal, what kids need, as you well know.
I know your kids and you know mine, so yes. I feel the empathy here, yeah.
And my husband and I, we don't have any family in the city. So all of our connections are friends. And so reaching out to other folks is maybe not, it's not easy, but it's also, it's a reality check when you realize, wait a minute, we're alone in this situation and now something is becoming really complicated. What are we going to do? What's the plan? And I'm a very much plan it, follow the plan, have strategies to mitigate if this, then that, so that I don't end up somewhere where we're in a panic, because I don't like panic. I think for me, where I am connected with the healthcare system, I was able to articulate things a bit better. I also think that I was able to check myself a bit from advocating too strongly for assessment or for, can we get testing done? Can we get this done? Can we get scans? Can we get all the other things? I think I took a step back, took a deep breath, and said, okay, if my family doctor, who I've trusted for 20 years, is familiar with me, he's familiar with my mom, he's never done, any disservice so far, why am I not trusting him now to just kind of say, okay, you've got this, you're aware, we'll come back if something changes, or come back in 3 months, or, whatever the indication was. And I think that was helpful. I think I may have, when I got a colleague of mine to see my mom as she had deteriorated fairly rapidly, I do think that was a bit of don't want to say panic, but I'm going to say panic because I don't have a better word. But I think it was a need to have a second opinion of confirmation, and a second opinion, not so much of my family doctor's opinion, but my own, of just observing her and watching the progression of dementia and sort of saying, okay, am I missing anything here? Should we be doing something different? And I felt too close to the situation from a medical standpoint. I said, I need somebody else just to look at this and say, this is fine. Yes, this is what we're doing. No, you don't need to do X, Y, or Z. Yeah.
I think that's some very powerful self-awareness. I think just to understand where you are in the moment. People talk about mindfulness, but putting it in practice in moments like that is really difficult. But to be aware of what your needs are, or where you are in your approach, or how you're approaching something, and what supports you need in that moment. Another set of eyes to assess something because you feel, again, you're too close to the situation.
Mhm.
So maybe some of those professional techniques are a little bit clouded. Maybe I don't want to put words in your mouth, but just that not as heightened maybe as they normally are, just because of the nature of the situation being so personal with your mother.
Yeah, one of my goals always was with my mom was that, as she became older, even before dementia, it was always on my mind that if she were to have some type of chronic progressive illness, that I didn't want to see her sitting in the emergency room for hours and days on a stretcher. Um, I wanted to be able to provide her safe care at home for as long as possible, for her to be as independent as possible. And that's really tricky when you're an only child because there's just one of you. And, my husband's been great as well and couldn't have really kept my mom at home as long as she was if it wasn't for both of us and our kids actually chipping in to make that happen.
Mhm.
I think one of the things that I was most anxious about over her period of advancing dementia before she went into long-term care was her safety. So was she going to get up in the middle of the night, have a fall, didn't know where she was? Was she going to, not be able to get help if she needed it? Was she going to wander away from home? Because for a while she was doing okay living on her own with us next door. But as things were kind of slipping, I was going, okay, where's the line?
Yeah.
When do I pull the switch of we need to go to either long-term care or community care? So that middle step. I don't think my medical education was top of mind. I think that's where my faith was more top of mind, and sort of I had to believe that that things would, when needed, things would present themselves, and certainly that was how things rolled out. And I know it sounds a bit over positive, and certainly it was stressful, moving her from her home to a community care residence. But it happened at the right time. A room came available at the right time. And then when she needed to move from there to long-term care, it happened at the right time. And it didn't happen in the way that I wanted it to.
Mm.
She went from her assisted living apartment to St. Vincent's nursing home. And I was told by a number of people in the system who were caregivers or caseworkers or whatever title they seem to have, that that probably wasn't the best place for her. So my anxiety was going up,
Mhm.
and I had to kind of look at that and go, okay, but what are we going to do if that bed comes available? What are we going to do? Can't stay where she is because that's not safe and she's going to have fall. But people are telling me that's not the right path. And so it was really hard to know what to do. And part of that is because the system, which I kind of know in the background, is if you are on, sort of the more urgent list for long-term care and you refuse the bed, well, you're off the list and you start again, right? And you have 3 months of, can't do anything until. So the system did create a fair bit of anxiety for me to, even though I knew the system, it was really, really stressful to have to navigate that from the caregivers.
And I when I think of those people that don't have that knowledge and have to navigate the system. Not that yours is less stressful, because you're also finding that tension between the role itself and the knowledge that you have, and then also trying to navigate it as a daughter.
Yeah.
A number of things that you said, I'll just backtrack a little bit. We haven't had that many episodes of Still Here yet, but when I hear commonalities like safety, for instance, creating a safe environment, and okay, this is no longer becoming safe. And what is that line? Where is that line? Because nobody really tells you that. And so when you cross into this idea of relying on your faith, which again, to me, that I understand what that means, relying on faith. Although it's not easy, and it doesn't, like you said, doesn't manifest exactly the way you want it to, but there's a timing there, which a lot of times we can't manipulate. And I think that when we see it, when we step back and we actually look at the story and how it unfolded and in the instances, we can sort of more clearly see it when looking back. But that, as you now are sitting here, what would you say to someone in a similar situation? What words would you give to them if they were, say, nurse practitioner or physician or some other professional caregiving role, trying to navigate this personally as well?
I think what was most helpful to me was having people in my circle that were other professionals in healthcare to bounce those ideas off of. Like, am I too close here? Obviously, I'm too close. It's my mother. Am I overreacting? Am I underreacting? What do you think about this? Talking through some of the things that are conflicting. So, going back to the decision about, St. Vincent's or somewhere else, although it had the shortest wait time to get people in from home or assisted living. And I just happened to bring this up one day to a colleague of mine who had an office across the hall. We didn't actually work together. We just knew each other from passing in the hall, had a few chit chats, that kind of thing. And she's like, "How are you doing?" I'm like, "Oh, dealing with my mom. Oh, how's your mom?" And talked to her about that a little bit and told her about the struggle I was having about when to sort of say, yes, okay, these are the top three long-term care facilities. Do I put St. Vincent's at the top or not? And I knew nothing about her connections beyond, she is a social worker. She works across the hall from me, nothing more. And those words that she said, I'll still remember them for a long time. She said, "Oh, that place is wonderful. If I needed to go to long-term care, that's where I would want to go." And it was such a relief to hear that from someone who wasn't connected with the situation, who didn't really have a sense of how urgent or not urgent, or how much pressure I was feeling. And for her to provide that level of reassurance from an outside. And it was so honestly said that it was, instantly felt, relief of, okay, I don't need to stress over the ranking. I can do it based on, do I feel she needs the most urgent bed? So that's one thing I think, talking, right? Talking with friends, talking with people who are connected in the system that you might know, or even talking if you're having a rough time, somebody says, "Hey, how are you?" You maybe don't know them well, just
giving that genuine answer.
Yeah.
And I think we all know when people really want to know how you're doing.
Yeah.
Right. Those instincts. And I sometimes say to clients when they say, I ask them how they're doing, and they say, "I'm fine." And I joke and I said, "Fine stands for feelings intentionally not expressed." And the idea of that is that sometimes, we do just say, "Oh, we're fine," because the day doesn't permit or the moment doesn't permit. But when someone's genuinely asking, it's for the benefit of the person. and really it's benefit for both of those people. I think that that person heard you talking right now and knew that she was the one to alleviate some of that stress for you
Yeah.
in that moment. That would probably be pretty joyful for her, I would imagine.
I did go back and tell her
Oh,
afterwards.
there you go.
Yeah.
That's a gift.
Yeah. Yeah.
A gift.
And I think that was probably the best example that I had, but, other sort of similar examples of other people I reached out to about specific things and just kind of said, look, can I run this by you? And it gave that sense that because I wasn't able to be objective myself, and it gave that reinforcement of, or that check of, you know what, you might be being a little too hard on the, expectation here, maybe step back a little bit. It's going to be okay.
Mm-hmm.
Yeah.
So now you are with your uncle, you're navigating that
Mm-hmm.
back and forth. So you were in PEI this summer.
Yes.
Is that for yourself an expectation where there's a kind of a more of a regular visitation and checking in that way?
Yeah. Yeah. I do check in on him. It's unfortunately his dementia has progressed to the point where he's no longer aware that his family are there visiting him, and he is receiving good care. He did have some health issues about a year ago that were quite stressful. He had had a fall and fractured his hip, and it wasn't picked up on until a month later. And so I had to learn to trust the system again.
Mm-hmm.
And fortunately, he couldn't have had a better outcome with surgery. He had no complications whatsoever. And the surgeon, I couldn't have asked for anyone better to be talking me through what was happening, what the risks were as I was driving over the Confederation Bridge to get to the hospital, to make sure that, someone was there for him, whether he knew I was there or not. But it was hard getting to trust again.
Mm-hmm.
Yeah. And always to check, my expectation. Could I have prevented it? Would I have picked up on it if I were at home with him? What is the alternative? Right?
Mm-hmm.
There isn't a, oh, well, I'll just go down to the other long-term care place. We'll just go there because it will be better. There isn't that alternative, and it would uproot him from the community where people do know him, whether or not he knows them, but they're familiar with him, and there's value in that, I think.
Yeah.
So sort of processing through all of that anger. Like, how could you let this happen?
Mm-hmm.
How could you miss this? And then kind of going, okay, so now where do we go from here? How do we prevent this from happening again? How do we prevent falls? And having some quite pointed conversations actually with the various people. And I think that may be key, is recognizing who are the people that you need to talk to. So maybe the caregiver, the nurse who's on shift when you happen to call or they call you and say, oh, he's had this happen. That may not be the person that you need to talk to about the bigger problem. Mm-hmm. It may be the thank you. You've told me about this problem. You've told me you're dealing with it. Who should I talk to with my concerns? And then taking that forward and having those conversations when it's appropriate to do. You deal with what's the urgency, what's the emergent problem. Make sure that, everything that you can do in the moment should be done. Mm-hmm. If there's consent to, give a treatment or whatever. But then, how do we prevent in the future? What led to this and what are the preventable things? And I think that piece of my professional life allowed me to maybe keep my personal feelings a bit in check and not kind of go off the deep end.
So maybe you're switched, and maybe you can kind of go back and forth between those two modalities, between the professional and the personal, and use both as a strength.
Yeah.
Trust is a difficult one when it's challenged, and to keep it safe, to keep it from falling apart.
Yeah.
Because we do need it. We need trust in our healthcare system. We need trust in those professionals, and I think that really to maintain that trust is good communication, and advocating in very clear ways with the right people, as you put it, to be able to really be clear as to who are we talking to, who do I need to talk to,
Yeah.
and to really to go into a preventative mode. We don't want this to happen again. Yes, it's happened. You deal with it. What's the problem? Where are the solutions? But who do I need to address this with so that we all get better as a result of it?
Exactly. Exactly. Yeah. And I realize I'm sitting here, a year later and talking very calmly and, having reflected on the whole experience that, was over a period of months. And it certainly wasn't that easy in the moment, right? I was visibly stressed because he's my uncle. I am also responsible for him, and really feeling completely powerless because I'm, removed from the local area, and also I can't be there all the time.
Because you have a family, and you have a career, and all of those things, and the geography of it all, and
exactly, yeah. And I couldn't, even if I had wanted to, with him or my mom, I couldn't have looked after them. Their care needs were just way too much for one person to manage at any point, sort of during their illness where they required long-term care. And I think that's, something where I have to remind myself that when I kind of, well, if I were doing this, I would make sure that this didn't happen, or I would make sure that, well, why couldn't you do that? Because, and then I have to step back and say, no, I probably couldn't do that either. Might want to, but if it were me all by myself or with another, maybe couldn't do the care any better. Maybe it would be a whole lot worse.
Well, humility, perspective, it's valuable.
Yeah.
Not as regular in our world as we maybe sometimes need it to be. A little more humility would be good. Speaking of kind of where you are now, and as you are coming here to the studio from work, how has all of this informed your day-to-day work in terms of meeting with patients and meeting with other caregivers and all of your own communication? How's that been affected?
Yeah. So I think it's been something I've reflected on, I think, my personal experience. And I think personal experience does inform if you take that time to reflect. And I can now see where other people may be having struggles, where prior to these experiences, I may have said, yeah, that's hard. But now I know how hard it can be. I think one of the things that I think about is when I'm talking with someone who is more isolated. So, the person who says, we're really, it's just me and my spouse, and I'm the caregiver. They need care, 24/7, and I get some respite, but really, if I'm not around, not a lot, there isn't anyone to pick up and step in and give me a hand. And that's really hard, right? Because then you're trying to care for yourself. And that's so important when trying to care for someone else. If you're not healthy, if you're not well, if you're not doing all the good self-care things to keep yourself physically and mentally well, then it becomes really challenging to care for someone else, even though you may want to. You just don't have the gas in the tank to do that. I think that talking with people, asking them how they're doing, spending perhaps more time with caregivers, asking them those questions having them feel that there is at least someone who will listen and provide some level of support, such that I'm able, as an ear, because they may not have that opportunity anywhere else. I think if I look back, I may have, focused more on the individual who was my patient, how they were doing and what we could do for them, without really looking at the caregiver and saying, how are you today? Like, are you okay? Do you have what you need? And, and maybe it's that, it's as good as it can be. And we just talk about that for a moment and take that moment to say, yeah, yeah, it really sucks when home care has a cancellation because of weather, or when, the caregiver that you hired disappeared. They quit. They gave their resignation, and you're kind of in a lurch. And what do you do about that? But I think that even just allowing someone to have that moment to say, this is where I'm at and this is where I'm struggling, someone hears them. Because I was so grateful when someone would hear me. And then if I can offer some suggestion, I will. If I can't do anything more than just say, look, if you feel like it's getting overwhelming and you just need somewhere to vent, I'm happy to have a chat.
To be seen, how powerful is that? Just, I see you, and this is not about being able to solve everything in this moment.
Yeah.
But I see you and I hear you, and I'm a place where you can come.
And sometimes it's just that safe space to talk. And maybe you don't know what you want or need, but you can just put it all out there. And then you don't have to see that person across the table, or, it's not a family member. So there's the hope of no judgment. There's no expectation, it's just a space to think out loud. And I try to create that both for patients of mine, but also, their family members, if that's the person that I'm most able to support at the time. Yeah.
Well, and thank you also for bringing up self-care, because that was one of my other questions. And just said, what did that look like for you? And self-care is ongoing, right? It's not something that I was talking with people in terms of, their health and building health to build resilience. And the idea of that is you don't necessarily work out and eat right for 1 year and then take the next year off. It's this idea of how do you add these things to our lives in meaningful ways and in consistent ways that are doable. And maybe just, what would be something that for you, maybe what has changed, over the last number of years? How is self-care manifested for you?
So I've never been one to be good at self-care. I think in a lot of ways I thought I was. In a lot of ways that, I thought I didn't need it because, I got this. I'm good. I can. One of the things my mom used to say all the time was, she can do anything. She's always there. She can do anything. She can solve the problem, and to a certain extent, I don't think I actually believed it, but I certainly behaved that way, especially with my mom. And probably with my kids, and probably my husband would say, you probably would take on things and do them, even though you could ask for help and we would have helped you, and that would have been good. And not talking about huge things, but even just the day-to-day kind of stuff, sharing stuff around the home, or saying, look, hey, I'm having difficulty getting these things done. Can you help me? Or how can we do this better together? And it's tricky, right? When you're living with caring for someone with dementia, because they don't have their expectations. They can't adjust those expectations. Having a conversation about boundaries and what I need for me, for my own self-care, for my own health, doesn't really factor in because my mom was focused on what her needs were, and being an only child, I didn't have anywhere to share them with, right? It was, you're it, which I was it, from a child perspective. But I don't think I did a particularly wonderful job at doing the self-care. So getting away, getting a break, and not taking it with me. Not thinking about, not planning, not worrying, not guilt. Oh, I'm going to take today and a me day, whatever that means.
Yeah.
I don't think I could always separate from and actually feel okay about not taking my mom out, or when she was able to do those things.
And I've heard that before. I've heard the fact that you're just so in that moment, that role of caregiving, self-care. It just seems inaccessible. It doesn't seem like something that's, again, guilt-ridden more than anything. And I think that the idea of for our caregivers, as we look at ways to help them, is to maybe recognize in the moment what could it look like, and help them in those moments, to give them some relief, some respite, so that they can actually have a moment, because they're being depleted, and they're going to hit those walls, and when their health suffers, their ability to care for suffers. And so we really, I think, as a community, really need to be able to understand, well, what does it look like when a caregiver is suffering too? And how do we become present for them? What questions can we ask them that don't overwhelm them, that instead help them? We're always going to be left with questions at the end of these podcasts, because that's where we're at. We're at trying to talk to people that are in amongst these situations that are unique, and everyone's caregiving experience is unique. But you have a heart for it. You have a professional heart for it. And to hear how this is unfolded for you, I think is really going to be able to help listeners to understand they're not alone. And because there are other caregivers out there that are in these dual roles. And I really thank you for being here to be able to share your story so that they can benefit from it.
I think if I had one sort of overarching piece of advice, or maybe piece that helped me the most, is learning to ask for help. And it's okay to say you're not okay. That doesn't mean that the world is going to crumble underneath when you ask for help and say, look, I can't do this on my own. And help maybe just sitting and having a chat and saying, this is how it is. And it's okay for things to be hard. I'm much better at self-care now. Sometimes.
We're all learning.
Yeah. And, but I think that takes work too, right? The self-investment, but it is about talking with other people, because sometimes someone says something in a certain way and you go, wait a minute, that really changes how my perspective is on what I've been struggling with, or what I've been thinking about, or a decision I've been trying to make. And when we don't know the future, we can only decide based on what we know in the moment. And it's important always to remember that you can't predict the outcome. You may try to engineer the outcome, but we don't have control. You make the best decision in the moment, with what's available, and then keep moving ahead, not looking back, not looking too far forward, and trying to stay with where we are right now and being present there. Yeah.
Very well said. Thank you, Trudy. Thank you for sharing. Thank you for tuning in to the Still Here podcast. You can find us on YouTube or wherever you get your podcasts.